The household-based survey aims to gather information that the government will use to ensure that every household in South Africa has access to adequate food and nutrition through targeted interventions and effective planning and deployment of resources for food production. Phase 3 covers Gauteng, the Eastern Cape and KwaZulu-Natal. Phase 1 was conducted in 2021 in Limpopo, Mpumalanga and Northwest. Phase 2, which took place in the Free State and Northern Cape, will conclude in the Western Cape later this month. The objectives of the survey are to provide a baseline assessment of the food security and nutrition situation in households. According to the study's principal investigators, the Human Sciences Research Council's Dr. Thokozani Simelane, the survey is South Africa's first in-depth countrywide study of food security and nutrition vulnerability.
Well, to help us understand this survey, Dr. Thokozani Simelane is Research Director at Africa Institute of South Africa Research Division of the Human Sciences Research Council and Principal Investigator of the study. And he joins us now via Zoom. Dr. Simelane, thanks very much indeed for joining us and welcome to the program. How important is a study like this?
Thank you, Peter, for having me, and greetings to viewers at home. This study is very important for South Africa, taking into consideration that the food insecurity is a global phenomenon. This phenomenon does not necessarily derive from the fact that the world is facing the issues of climate change, but also the political instabilities that point to the importance of connectivity on food supplies across the world. For South Africa, the study is very important in the sense that over the past years, South Africa has never assessed the status of food insecurity at a household level. So this study is important as it has already been indicated that through the results that are going to be generated out of the study, the government will then be able to plan appropriately for the intervention measures that can improve the food security at a household levels of South Africa.
So how do you go about measuring food security? What are the indicators that a household is food secure?
For this study, we have over 90 indicators that are classified as the demographic indicators. The demographic indicators largely relate to collecting information about the number of people in the household and the sex ratios of the household heads, and also the incomes of the household and various other aspects that relates to how many times do people eat in the household, just to mention the few. So all in all, there are more than 90 indicators that we are assessing at a household level.
All right. Is there a link between food security and nutrition, for example? So you might have food in the house, but not necessarily the right kind of nutrition coming from there.
You are 100% correct. And it is a well-known phenomenon in South Africa that although at a national level, it is known that South Africa is food secure. But if you look at the nutrition component, I mean, South Africa is one of the countries that are experiencing obesity, which then leads to non-communicable diseases, a variety of them. So, of course, yes, there is a link between the food security and nutrition. And this is one of the aspects that we'll be investigating as to whether people in the household are eating nutritious food. So we hope that we will be able to make a contribution in developing an understanding of the link between food security and nutrition in South Africa.
So this is phase 3. What has come out of phase 1 and 2?
Basically, for phase 1, which started in the province of Limpopo, of which data, the analysis of data has been completed. There are, of course, a number of indicators. Firstly, we have been able to determine that the average age of the household head is not more than 55 years old. Over and above that, we have noticed the pattern that the households that are headed by female are more vulnerable to food insecurity than the ones that are headed by male. Also, it had come to our realization that for South Africa, food access is largely linked to the income of the household.
All right, so what are you expecting from phase 3? I suppose these are good indicators of what you might find as well.
Moving forward, I mean, at this point, I can't say with certainty what patterns are going to emerge across the provinces, but we are busy at the moment analyzing data per province. And what I've already shared with you, we will be monitoring it very closely as to determine whether the patterns are similar across the provinces, or maybe there are certain patterns that are not as usual as one would expect. But as we move from phase 1 to phase 2, we will then be able to closely monitor those indicators that might require attention from the policy intervention by the government. But it's too early at the moment to say whether the patterns that are going to emerge will give an indication of whether the interventions that the government will have to employ across the provinces are the same, or they need to be tailor-made from province to province.
I suppose some of us might have a gut feeling about this, but the urban-rural divide, does that also tell a story in terms of food security?
Certainly. I mean, contrary to, this is a very interesting point that you are raising, because contrary to the belief that there is a high food insecurity in rural areas, the reality is that in essence, there is a high food insecurity in urban areas. Why? Because in urban areas, the land or access to land is minimal, and people largely depend on cash for them to be able to access food. So these people are actually mostly vulnerable to shocks, like we have observed in the past during the COVID-19. Most queues, or people who were queuing for food parcels, were in urban areas. The rural areas are a little bit stable because they do have an option of producing their own food.
So you talk about the use of the survey results, perhaps as an assistance for policy interventions. What kind of policy interventions might result from the work that you're doing?
Basically, I think the most important one would be to re-engineer the social security system of South Africa. At the moment, South Africa has not less than 160 social programs. And these programs, they are being implemented, some of them without having a clear understanding and knowledge of whether they have a desired impact. With this kind of information, the department will then be able to formulate the interventions that are targeted to the problem or the issue that requires to be resolved or solved. In particular, for instance, suppose we come up with a recommendation that the government needs to improve the nutritional status of food that is consumed in household level of South Africa. And then the government will know exactly what kind of crops, what kind of stocks that need to be produced, which will then be able to provide a nutritious food at a household level within the South African context.
Yeah, and I suppose there could be other interventions, as maybe even making sure that children at schools get a proper meal, at least one proper meal a day.
You are 100% correct. I think, again, one of the additional possibilities will be to encourage schools to produce their own vegetables and fruits so that they can supplement what the government is giving them. That is a very possible point that you are raising, Peter.
This information that you're gathering, how are our brothers and sisters in other parts of the continent doing in terms of assessing this? And I wonder if learnings here in South Africa could be shared with other countries in the region to deal with the similar issues.
Certainly, that is an intention. In actual fact, the program of food security is a regional program, as well as also a continental program. Various countries across the region have been monitoring and assessing the state of vulnerability to food, but using a particular methods, which we refer to as the household economic approach. South Africa was then requested to test a method that combines collecting data at a household level, as well as also finding out or collecting information through the household economic approach. And the third component of determining the nutritional status of a household using what we call anthropometric measurements. So South Africa, over and above what it is doing in terms of collecting this data for the first time, and through this study is testing or developing a methodology that will combine the three components of assessing and determining food insecurity at a household level using the household economic approach, household data collection, and the determining nutritional status through the anthropometric measurement. We have developed this method, and it seems to be working based on the data that we are collecting, and certainly it will be shared with the region at a Southern Africa Vulnerability Assessment Committee. Surely the region and the continent is going to benefit out of this study.
All right. Okay. So how long do you think it'll take before you have a full picture of the situation on the ground and are able to give concrete advice in terms of information to government?
At the moment, we are collecting data, as it has been indicated, and we are on approaching stage 3 of the collection of data, which will be completed in July. Thereafter, we will engage on packaging, processing, and analyzing data. I can say before the end of the year.
All right. Dr. Simelane, we certainly wish you the best in terms of gathering this very important information. And we thank you so much for joining us and giving us some highlights about this work and what it will yield once it's done. Thank you so much for your time.
Thank you for having me. A great appreciation from our side and the research team. Thank you very much.